Hi, everyone. I'm just going to wait one more minute to see if anyone else joins. Okay, we'll get started now. Thanks again for joining us today again. We do have Dr. Joyce Locke with us today to deliver her media briefing. So we'll get right started and I'll pass it over to you, Dr. Locke.
Thank you. Good afternoon, everyone. I'll start today's media briefing, as I always do, with a look at our most recent data. Today we have 8 new cases, which brings our active confirmed positive cases to 90. 1 person is hospitalized and in the intensive care unit. And the good news is none of our long-term care homes or retirement homes are in outbreak. And this speaks to the benefit of the vaccine that all the residents and staff there have received. We have 17 active cases of the variant of concern, which is now 19% of all of our active cases. We continue to see VOCs increasing in our community case counts. So moving on to transmission and lockdown, or the province's emergency break. After a year of watching numbers go up and down, it can feel like too much for all of us. Yet we can't become complacent, particularly as we go into this Easter weekend. We can't forget that the numbers are more than numbers. Each of these numbers reflects a person who is sick. Fortunately, some are only mildly sick, but some are very seriously ill. It can also be easy to point to the numbers and rationalize that it's happening to someone else or somewhere else in a school or a workplace or a long-term care home, and that it's not going to impact me. But the reality is that COVID-19 is everywhere right now. It's in every demographic in our community and in every single community. So when numbers are increasing and trends are worrisome, we can't turn away from the numbers. We need to use these numbers to fuel our resolve to make us more determined, to continue on our journey to mitigate transmission. What we need to do most right now is to prevent the variants of concern from spreading further. These variants can derail all the work we've done over the past year to help COVID-19 in our communities. They spread more quickly, and we've seen that in households, and they are making people sicker, and we've certainly seen that in our ICUs and our hospital admissions in the larger urban centers. These variants of concern are deadlier in some populations. Easter is this weekend, and it's usually the springboard for the beginning of the warmer days and the longer days of spring. And many of us are hoping that with that warmth and sunshine, it would be safe to gather. And instead, we are entering into an other lockdown with the emergency break that the Premier just introduced. So we ask you all, if you're going to think of attending church, please do so virtually. If you're thinking of connecting with your family, please do so online or by phone, and do stay in your small family bubbles. The emergency break has been put on the province for 4 weeks. We have seen in the past when the province introduced these stricter measures, it always had a good impact. If we all buckle down once again for the next few weeks, Hopefully in 4 weeks, we will emerge and able to resume more of our activities. Moving on to a happier note, some good news today on the vaccine front. Starting today, 3 local pharmacies will begin booking appointments for AstraZeneca COVID-19 vaccine for eligible people age 55 or older. The province selected 2 pharmacies in Ingersoll, the PharmaSave and Remedy RX, and also the Shoppers Drug Mart in Woodstock at 959 Dundas Street. And more pharmacies are expected to be added to that list in our region, making it easier for all of you to get that important dose of your vaccine. So in conclusion, we are entering into the emergency brake situation. Hopefully it will be short-lived and only for 4 weeks. We ask everybody to carry on. We are seeing more and more individuals in our community vaccinated, and we are confident that by the end of September, all of you who want vaccine will have it. On that, I'll close and hand over to Carla again.
Thanks, Dr. Locke. So we have time for 2 questions each today, and we will start with Chris McMillan.
Hi, Dr. Locke. Thanks for taking my question. We're entering the 3rd lockdown here. People are pretty frustrated. How are we going to keep this message positive over the next 4 weeks? Because the support right now is not what it was at the start of the pandemic.
That's a really good point, Chris. Even me, I kind of felt a little down when I heard the message, particularly as we're entering the summer and we do so much want to get back into our soccer teams and baseball teams and family picnics, etc. So I can only ask people to say this is a marathon. It's taking a long time. It's been tough. We're not there yet, and we just got to keep moving one step at a time. I agree that our steps are not light-footed anymore, but we do need to keep going on and to keep doing what we've been doing so well. There is more light at the end of the tunnel than there was a year ago, which is those vaccines. And the good thing is that the vaccines that we have shown good effectiveness for the variant, the native variant, and the B.1.1.7 variant, which is the other variant, which is the only other predominantly circulating variant. So hopefully the 2 variants that we have, the native and the B.1.1.7, we will be able to battle them if we all get the vaccine. So and we hope to have everyone with the vaccine by the end of September. So it's coming. It's going to get better.
Follow up, Chris?
Just on the vaccine front, I've noticed on the dashboard, I've been following it every day this week, the numbers for the first dose haven't gone up. People are asking me all the time, when are we going to expand that? And we're hearing that we're going to get a lot more in the month of April. Are we going to start to see, when are we going to start to see expanded hours at the clinics or the mass vaccination sites and hopefully see more people able to get vaccinated? And how much will the pharmacies help with that as well?
So we've been steadily offering more doses every week since we started. At the moment, we are not extending hours at our mass immunization center, but we are enhancing our efficiency there. So initially, for example, at the Woodstock site, we were going through about 350 people a day, and our aim is to get through 500 or more. Once we maximize our efficiency, then we will start to look at expanding hours. The other thing is that we are looking at making sure that we use other channels of vaccine delivery. So some vaccine is now going to hospitals for use in those individuals with the highest risk medical conditions, such as so those who are on dialysis. We're also going to start a pop-up clinic in Tilsonburg before long, which we are going to be running in conjunction with our EMS partners. We have the pharmacies coming on board. We are going to be receiving the AstraZeneca doses soon, and then we will distribute them to the pharmacies. And also now that we have some Moderna, our ability to be mobile with the vaccine is also improving. So we hope to be working with some of our primary care practices to get them some Moderna, as well as we are going to be looking carefully at how we can identify and reach our homebound citizens through our mobile methods. So in addition to the numbers that we are increasingly growing through our mass immunization centers, we will also be beginning to invest more doses through those other channels to reach people in several different ways with the vaccine.
Thanks, Chris. We'll move on to Rob Perry.
Hello, Dr. Locke. I just wanted to ask you, first off, I know that religious services and weddings and funerals and so forth are now limited to 15% of capacity. I assume, but please confirm for me one way or the other, that drive-in services will still be allowed.
Yes, drive-in services are still allowed. Yes.
Excellent. And the other point is, I believe you just put out a tweet from the health unit about helping older residents get an appointment for vaccination. I think I've heard some talk about older people, certainly those in their 80s, who don't have computers at home and are finding the phone lines too congested. I see you put out something about helping people volunteering to help. Could you tell us a little bit about that?
Yeah, so we have noted that for some individuals, accessing appointments, trying to use our online booking and our telephone system has been challenging. There is such a demand for vaccine that it can overwhelm both our booking technology and our telephone technology. And as such, we're trying something new, and people can find out about it on our website, where individuals can put themselves on a list with us. And then when we have extra spots, we will call you to come to us. So that not only for extra spots, so that we sometimes have end of day spots that are extra, but we will also be holding some spots on a regular basis so that people who are challenged in booking through our standard methods have other options.
Thank you very much.
Thanks, Rob. We'll move on to phone number ending in 2670, please.
Hi there, that's Kathleen from the Sentinel Review. Can you hear me all right?
Yes, Kathleen, sounds good.
Hi, Dr. Locke. Thank you for taking my questions today. I had a question about Woodstock school closures. So in the Southwestern Public Health region, we've now seen 3 school closures, all of them in Woodstock, all closed for at least a couple weeks. Is there something unique to Woodstock that we're seeing this problem here as opposed to in other areas? Why Woodstock, and what can the members of the community do about it with so many school closures?
So the feature in Woodstock has been the introduction of the variant of concern, the B117 variant, which spreads much quicker. And so what's happening is it's spreading through families. So families often have children in multiple grades. And then it also sometimes spreads between families or between individuals when households who are not related get together for some social event. And so then what happens is that if there are more than one family involved, then before long, you have multiple grades impacted. And that leads to the that several classes or many classes in the school have to be sent home. And that's what's happened at all 3 schools in Woodstock. And the schools have elected to close because there are just too few teachers or students to make it worthwhile to keep the school open. So the key messages to the public are that VOCs spread easily. So we really strongly encourage people to stay in their own household bubble so that you don't inadvertently spread it from your family bubble to another family bubble. And the other thing is that we are seeing that these variants of concern spread very quickly within households. Like within a matter of days, everybody in the family has the viral infection. So what we're strongly advising now is that if somebody in your family has symptoms of COVID, then not only do they need to stay home, everybody in the family should stay home until that individual gets their test done and knows for sure that they don't have COVID. So even if one person in your family has symptoms, and they're not even before you get the test, not even the test result is back yet, right away the whole family should stay home. And that will help to keep our schools open.
Perfect, thank you.
Any further questions, Kathleen?
Yeah, I did. I wanted to ask if we could go back and talk a little bit more about these extra slots and end of day slots for vaccine appointments. Can you speak a little bit more about how public health is organizing that and how that eliminates vaccine waste?
So there are the objective is to make it a little easier for some who have a hard time booking through our traditional methods to access doses. So that we do encourage everyone to use our online booking or our telephone line booking. But if you had trouble with that, particularly if you're elderly or you have trouble using technology, then there is a method where you can inform the health unit about that you're interested in the vaccine. We will take down your contact information, your telephone number, and either on the day of or the day before, but closer to the date, we will let you know that there is an extra spot and ask you if you'd like to take it.
Perfect, thank you.
Thanks, Kathleen. And moving on to phone number 4187. Are you still on the line with phone number ending in 4187?
Yes. Hi, it's Chris from the Telsmar News. Can you hear me?
Hi, Chris. I can hear you.
Thanks. So can you define before long in reference to mobile clinic in Telsmar, or potentially a longer term solution as in a brick and mortar type clinic as requested by Telsmar Council at its last meeting?
My staff informed me that they are in consultation with EMS, and there are some operational issues that we need to sort out internally. So our aim is sometime in April. I would think it might be the second half.
Okay. And as a follow-up, the fact that Ingersoll got 2 pharmacies to be delivering the vaccine, and considering they're a 10-minute drive from Woodstock, is the fact that Telsmar is getting a pop-up clinic the reason why Telsmar did not get a pharmacy here at the Shoppers Drug Mart?
No, it's not. The decision of the location of the pharmacies was made by the province, and what the criteria they use to make those decisions is unknown to us. Public health units were provided an opportunity to advise on the location of the pharmacies. We did not recommend the locations currently that receive the vaccine. So this was done outside of any decision making that we were involved in.
Okay, thank you.
And that concludes our media briefing for today. Thanks everyone for joining us. Have a great Easter weekend.